we see so many clients come in that have made investments that they wish they didn't or they don't totally understand. And so Kathy and I feel really strongly that education is the key.
Welcome to Money Talk with Terry and Kathy, brought to you by the Spectrum Financial Group, serving individual investors and retirees. Our guest in this segment is Karen Cooper. She has been an independent Medicare insurance broker going on 3 years. Prior to that, she worked in the medical field here in Albuquerque for about 20 years in the sales area. During that time, she became increasingly interested in being able to help individuals, especially seniors, help them understand their insurance before they signed up for a plan. After many years of helping patients navigate their insurance, she found her passion in being a Medicare insurance broker to educate her members on being able to find the best plan to fit their needs. Karen joins us in the studio. Welcome to the program.
Thank you so much. Glad to be here.
Absolutely. Great to have you. So I told a little bit about your story, but in your own words, how did this thing evolve where you really became a Medicare specialist and problem solver and advocate?
Well, I spent, like I said, 20 years in the medical field. And the very first thing that whenever you went to go see a client and they had a patient for you, the very first thing you wanted to know when you were going to see about taking them on service was, what is the payer? And so then you go from there. And it would depend on which direction you could go in depending upon the payer. So that was always the very first thing that you looked at. And as time went on, there were so many changes with the payers. It was very hard for our customers to keep up with all those changes. So as a marketer, that was kind of my job to educate them on, which payer took care of which services. And so then Medicare made a lot of changes about 5 years ago. And so they required a lot more documentation for products and services, and it became ever more complicated and difficult. And so that's really when my passion began to grow, and I wanted to be able to get to people before they signed up for a plan. Little did I know there was a job out in the community that did exactly that. So after talking with enough people and telling them what my dream was, I found where I landed, and it was just a beautiful marriage.
That's perfect. Yeah, perfect combination of advocacy, an understanding of the systems, the changes, the challenges. Anyway, we're going to dig into a lot of these now and clear the fog for me and our audience about how all of this works. As you talk to people from the very outset, what are some of the challenges you seem to see? What are the trending challenges, I'll say?
Most people are just so confused, and they get inundated with mail when they're turning 65. So actually, right after they turn 64, they start getting inundated with mail, phone calls, invitations to meetings, and it just becomes so very overwhelming for them. And if you're, busy in your life as it is, you don't have time to sit down and read all of that, educate yourself. So that's the biggest challenge is that it really gets them paranoid, so to speak, about, I have this huge decision on my hands and I have no idea what to do.
At what point do you find yourself first meeting with potential clients or people you're going to be working with to help them?
Usually when they're confused and they've had it.
So they reach this point of overwhelm and under Karen Cooper.
Mm-hmm. Or the time, clock is ticking and they realize, okay, I've got to make a decision. Yeah. I better do it soon. I'm going to get penalized. Many people are afraid of that. And so they somehow find their way to me. The same way I found myself to this business is they talk to people. Yeah. And they tell them what's going on and their fears, and they get led to brokers.
So a lot of your job, is connecting and becoming a trusted advisor and really helping people navigate. And part of my question there was, are they still working in most cases, or do you find
it runs the gamut? So some people that are still working, they're very worried that they're going to get penalized for not signing up for Part B, not realizing that they can continue to work after the age of 65. Yeah. So I find a lot of those folks. I find some folks that they are, doing the happy dance because they're 65 and they're done throwing in the towel. They're going to retire. They can't wait. Many people that are on the health exchange, their premiums are pretty pricey. And so they've heard by now that when you go on Medicare, you're going to give yourself a big pay raise because there's going to be more money in your pocket because your premiums are going to be a lot less.
Yeah. Yeah.
So some of them are very happy to meet with me.
Terry mentioned offline that you have several stories that might illustrate some of these challenges or some of the dilemmas or some of the help that you've provided as a result of hearing those stories. Can you share a couple that might really kind of uncover and unpack how you work?
Sure. I had a gentleman that was on the health exchange, still working. He was able to get a subsidy from the state or through the health exchange because of his income.
Yeah.
And he has a chronic illness. And whenever he met with an agent, they crunched the numbers, and the medications that he is on, which are life-sustaining, were through the roof, like to the tune of $20,000.
Oh, my goodness.
And he was just devastated. So he went back to his primary care doctor, was very concerned about what's he going to do when he goes on Medicare. And they happen to have, we have a close relationship with this practice, DaVita Medical.
Yes.
And so they called our corporate headquarters, and then our owner called me and said, "Can you help with this gentleman?" And through my 20 years of working in the medical field, I knew that University of New Mexico, for one, I know Presbyterian is another, there's certain disease states that they have to be on expensive medications. And so there's grants available to these folks to be able to afford their medication. So he and I hadn't really explored it too much, so it was a learning experience for me.
Yeah.
But together we called, got in touch with a UNM advocate. It was going to be able to pay his co-pays on his life-sustaining medications.
Yeah.
Plus, because of his disease state, it was also going to help him with some other procedures and services that go hand in hand with this.
Wow.
So he was extremely pleased that now he's got very small copays for these medications.
Wow.
He got on a Medicare Advantage plan with a 0 monthly premium.
Wow.
And a 0 premium for his medications. He's still going to be able to work. And so he was just ecstatic that this disaster that he thought was brewing because of a life change was actually, there was help out there for him. So that's one example. And for me, it was cool learning, something new that was available for someone in the community.
Exactly, Karen. And for those of us listening, including yours truly, it sounds like a puzzle that you're solving as you're faced with this seemingly unsolvable situation, and then miraculously, there's no copay, there's no premium. I mean, you really, really, if you glue these things together, these solutions together in such a way that they solve the financial problem, and I'm guessing more often than not, that's the crux of it, right? The economics.
And it's really a thrill to be able to solve those puzzles. And prior to being in the medical field, I was a broadcast news reporter.
Oh, wow.
And so I did a lot of investigating. And so, I'm just kind of following the same path that I did before. I'm just digging down.
How interesting. And that's something I didn't know about you as you walked in and we set up microphones, right? So really, it's your raw and authentic curiosity that brought you to all of this and now brings you one by one to these people to solve the unsolvable.
Exactly. And when I got into the medical field, my brother's children were diagnosed with muscular dystrophy.
Oh, my goodness.
And so I wanted to learn everything I could about it so that I could help them.
Yeah.
And so a friend of mine was looking for someone in sales to work in the medical field. And so I jumped on board because I knew that I would be able to find out things that they were going to need down the road. So it's all just kind of been a work in progress.
You do a lot in the community, and Terry was telling me about you, of course, before you came on the program. Talk to us a little bit about how you're involved, maybe even outside of the Medicare world and this core that you work on, what you're doing in the community. That would be great to share.
So I belong to Senior.1. It was also known as Silver Linings Care Guide, and it was put together by an individual that had a passion for being able for people to go to one place and find resources for people in the community that were aging. And so now it's Senior.1, and so they have a networking group. And what's great about it is that there's usually some type of lessons that they prepare for each meeting. And so there's also people there that work in different fields that provide you with information on what they can do to help the community. So it's a great place to go for resources. Yeah,
resources, exchange of energy, good things for the community. And you're very closely involved with that. Well, you're dealing with a senior population, and the population overall is growing older. So it's a growing place to be showing up. And as we're not going to disclose our ages here, but we're not getting younger. Let's just say it like that. So
exactly.
we have a lot of affinity for that population as well. It's amazing. I mean, I've got a wife and a mother and myself. We're all aging. I'll leave it there.
Yeah.
Get myself into trouble here.
Exactly. I also work with the Case Management Society of America. It's nurses and social workers that help people case manage through their insurance plans, through many of the doctor's offices and medical groups, the hospitals. And each year we have a conference. I help, put on that conference. And then we also have monthly and bi-monthly meetings to educate about different, resources or products or drugs, that are available in the community.
Yes. You've triggered something for me, and I know we plan to talk about it a bit as well. What changes are happening in this market as you entered 3 years ago, and, what have you seen so far, and what can we expect forward going?
Well, this year is going to be huge for changes. Because
of the tax piece of it, or is there more?
Because of the Medicaid piece of the pie.
All right.
So this year, the state of New Mexico awarded contracts to new and existing providers, but they only selected 3 providers on the panel. There were some that were not selected that are appealing that decision at this time, so we're not sure how that's going to shake out.
Wow.
We did have 4. They pared it down to 3. We thought maybe there'd be 5 coming up for next year. So whatever happens in the next couple of months will really help start to determine what people are going to be selecting for a Medicare Advantage plan, especially those that have Medicare and Medicaid. So some of them may be having to change their plans. Some of them, are lucky enough to be able to stay on their plans. But 2 of the providers that did not get selected had many more options available.
Well, I was going to ask you, Karen Cooper is our guest. She's a Medicare specialist here in Albuquerque, New Mexico, joining us to share her stories and her expertise around all things Medicare. Was it a more is more scenario? You mentioned options. It seems sitting here that if you had 5, that would have been a better thing sitting in your shoes, and certainly for your clients to have more options. Is it that simple?
Yeah, because, we could have left a lot of things the same, and now people are going to have to make a lot of changes.
And it takes energy, and, it's business and activity for you, but not maybe the kind you wish for.
So with all the confusion that comes along with being on Medicare and being a Medicare recipient, there's going to be more confusion because people aren't going to really know what plan that they need to select for themselves.
Right.
So we as agents are going to be a lot busier, and we may be switching, some of our members that we already have on service with us to another insurance plan because it's going to be better for them.
Yeah, the puzzle pieces change. We talked about it in terms of looking at a puzzle. Karen, this is a long-range kind of a relationship that an agent has with their Medicare specialist. That would seem to be a very appealing part of the work.
Yeah, it is.
The social piece.
You get used to your clients. Some of them, you really get some favorites. Some of them are so grateful Many don't know that they had more benefits coming to them. They didn't even know they qualified for them. So, for instance, in New Mexico, there's about 70,000 individuals that qualify for low-income subsidy to help them with their prescription drug coverage because of their income.
Wow.
And so they don't even know that they qualify for that. And so it's so rewarding to be able to find those people and then to be able to help them year after year. We stay with them as their agent. So if they have a problem with their insurance, they don't understand something, they get a bill that they don't think they should have received, they have someone to reach out to and follow up with, and we can help navigate that for them.
Beautiful.
And so they get very used to calling us. I tell my members, if we get you on a plan and you're happy with your copays, you kind of know what to expect, your medications are still on the formulary, then just let it roll over. But if you get diagnosed with something new or you get a new medication and it's not on the formulary, then most certainly come back and see me. And especially if you've had a change in your health, a significant change in your health within the last year, then you want to come back and see me because we really need to make sure that you're still on the right plan and getting all the benefits that you have coming to you.
Excellent. Thank you. We've covered quite a bit here in the few minutes we've spent together. Is there anything that you feel we haven't really covered that you'd like folks to know about as we wind down this segment with you?
Just make sure that you consult with an agent. There's never a charge to use an agent. We get paid by the insurance companies. We get paid the same commission for every plan so that there's no picking a favorite over another because it's a higher commission.
Right. You're properly incentivized, democratically speaking.
And, there are some captive agents that just sell one product. Mm-hmm. And so I like the availability of being a broker and being able to fit that patient, that member, to the plan that best suits their needs, rather than trying to mold my plan around their needs.
Beautiful. Karen Cooper, thanks so much for joining us on the program.
You're very welcome.
Thanks for listening to Money Talk, brought to you by the Spectrum Financial Group, serving individual investors and retirees. Find out more at sfgnm.com. Investing in securities involves risk of loss to both profit and initial investment. No investment process is free of risk, and no strategy can guarantee returns. Discuss with an investment professional the unique risk-return profile of an investment strategy. Past performance is not indicative of future results. Registration with the SEC or a state licensing agency does not imply a certain level of skill or training.